Hey guys, it's Dr. Alicia and Sarah here. Welcome. Today we are talking about our top 7 questions we get in the postpartum period. So we're going to answer those questions. We'll talk a little bit more about kind of our top tips and tricks for those.
Welcome to the She Found Health podcast. We are Doctors Sarah and Alicia. We're maternity doctors who are passionate about caring for women and young families from conception through the first few challenging years of parenthood.
We have 5 kiddos between the two of us, so we get it. We've been there, and we made it through to the other side, and now we want to support you through your journey.
We are delving deep into topics to prepare you to have the healthiest pregnancy possible, the best birth you can, and to thrive rather than just survive during the newborn and postpartum phase.
We want to remind you that the information that we share is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information we share may not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
All right. So postpartum can be a really overwhelming time. And we support lots of new moms through this. And we want to make sure that we give you the best information we can. And so today we're sharing with you the top 7 questions we get postpartum. First question, how long do I need to take my iron supplement for? So this really depends on how low your iron is or how low your iron was in pregnancy. If you didn't take an iron supplement during pregnancy, typically you don't need to start one postpartum, but if your iron was low or you had significant blood loss, we would usually recommend you take it for at least 3 to 6 months after delivery. We don't routinely check people's hemoglobin or iron levels, but if you're still symptomatic, meaning, you're really fatigued, you've got sometimes restless legs at night, or other symptoms of low iron, then we can check and just make sure that you are absorbing that iron and your levels are topping up. But typically 3 to 6 months is adequate, especially if you're thinking that you might want to have another baby not that far down the road. It's really important to build your iron stores up as much as we can before another pregnancy.
And another tip that we have is certainly when you're taking an iron supplement, and some of the ones that we recommend are Palafer, Optifer, or Proferin, is to take it every second day. We actually absorb it better if we take it every second day as opposed to every day. 2 hours away from calcium or dairy, and with a little bit of vitamin C or orange juice. Help the absorption much better. And away from coffee.
I know.
Bummer. So second question is, how do I improve milk supply? So this is kind of a twofold answer. So it depends on where you are in your breastfeeding journey. And I'm assuming that since you're wanting to increase your milk supply, you're in a breastfeeding journey, either pumping or actively breastfeeding. So the most important thing is getting off to a good start. So those first few hours to days are really important in establishing your milk supply for the long term. So there's a great website, we'll link below, www.firstdroplets.com, she goes over all the science and some great tips and tricks on latching and hand expression and when you need to start power pumping or hands-on pumping. But essentially, your little newborn is transitioning from being on the inside to being on the outside, and they need you so much. So spending a lot of time skin to skin with your newborn, you release that oxytocin, which is that love drug, but also helps with our milk supply, and frequent feeding. So you'll notice in those first few days, your baby is wanting to feed every hour or two, and that's because their bellies are wee, and they're not getting a ton because you're producing colostrum, which is really nutrient dense and wonderful stuff. So they need to feed frequently. And if they're feeding frequently and you have a reasonable latch, then your milk supply is going to be optimized to meet their needs. One tip that certainly at the First Droplets website is hand expression and learning how to do that. And you can practice that, 38 weeks on, is getting a little bit of extra colostrum out in between feeds. And you can top your baby up with that with a spoon or a syringe or a little cup. That helps them stay hydrated and decreases the risk of jaundice a little bit because they're just a little bit more hydrated. So that's a great way of starting off your breastfeeding journey to optimize your milk supply. Now, if you've been breastfeeding for a bit and you're finding your supply is low, i.e. your baby is not gaining weight, well, that's how we tell if your baby is getting enough, if they're gaining appropriately, or if they're not seeming satisfied at the end of a feed, then you can practice a technique called hands-on pumping. And again, there's a great video in that website on hands-on pumping, and you can use the same technique while you're feeding. So when you're actively breastfeeding, using that hand expression technique to help really empty out your milk ducts, because when they're emptied, it triggers our brain to increase the stimulus to produce more milk. So the more frequently you empty out your ducts, the more likely you're going to produce well for the long term.
Yeah, and it's really interesting. Since COVID, we've had a reduction in visitors on our mother babe unit. And because we're having less visitors, more skin to skin and, chest to chest time for moms and babies, we're seeing improved breastfeeding success. So I think that really speaks to the importance of that just sort of unrestricted baby on your chest as much as you can in those early days. So another question we get is, when can I start exercising? And this answer is a little bit different for everybody. Typically we say, listen to your body and start slowly. If you've had a C-section, we absolutely say, wait until at least 6 weeks to start doing more vigorous activity or lifting anything heavier than your baby. And we also recommend typically avoiding any exercise that put any extra pressure on your pelvic floor. So that's heavy lifting or running, so just starting by simple walks around the block, gentle exercises at home, and let your body be your guide. If you've had a cesarean section, or if you had a complicated delivery, I would recommend around the 4 to 6 week mark connecting with a pelvic floor physiotherapist. They can absolutely do a great job, not only in helping you with your pelvic floor rehabilitation, but they can also guide you in terms of what exercises are safe and getting you back into your into whatever fitness level you're hoping to get back to. We actually did a podcast with Krista Warwick from Karen Physiotherapy, and we'll link that in the show notes below. And she talks a little bit about that in more detail.
So the next hot topic is, when can I have sex after delivery? Now, I'm making a bit of a joke here, but it's usually the partner who's asking that before the mama is. But certainly it's a question. It's a question from both sides. And so the answer is when you feel ready. Every postpartum person is different, and every delivery is different, and so it's going to be how you're feeling supported at home, because we know for women especially, sex is not just sex, it's the whole picture, and so generally most women don't start having intercourse until 4 to 8, even 12 weeks postpartum, depending on how they're feeling, if they had a tear, if they had a cesarean section, etc. Certainly some common issues are dryness, vaginal dryness, especially if you're breastfeeding, because your estrogen levels are low. And the role of estrogen in our vagina is to plump up those tissues and help with lubrication. So you will notice that things are going to feel different and they're not going to feel as lubricated. So making sure you're getting a good lubricant and keeping that by your bedside, and going really slow to start with. It can be really scary for women who, especially who've had a tear, to have intercourse. So certainly going slowly, using lubrication. And the other thing, and we'll talk about this a little bit more, is making sure that you have a good birth control on board if you're not wanting to get pregnant right away. Correct, Dr. Sarah?
Oh, correct. My baby's first two were 14 months apart, meaning I got pregnant 4 months postpartum. And I'll tell you how not to do that. The other thing I often think it's important to remember is that sex and intimacy can look different postpartum, and that intimacy doesn't have to mean sex. So you can start by having open conversations with your partner and start with things just like cuddling, when you're typically, at least I know me, when I was postpartum and breastfeeding, you're just touched all the time. So you can sort of feel touched out. So communicating that with your partner, and navigating other ways that you can be intimate with one another until you're feeling ready for more penetration or other forms of sexual intercourse is a really important thing to remember. Also, separating sex from bedtime, right? Because a lot of people, when you don't have children or when your children are older, that's the time when people often think about having sex. When you have a new baby, you're completely exhausted. So making sure you articulate that with your partner, that if you are going to be sexually active, make sure there's no expectation around bedtime, because that can be, increase, your sort of anxiety as it's coming up if you're really not feeling up for it. You don't want to have to let your partner down. Just have open and honest conversations, and gradually your sex life will turn into, the way you want it to look like.
So Dr. Sarah is going to talk about what birth control options there are after delivery.
Yeah. So birth control. This is a conversation we have with our postpartum patients at the sort of 2, 4, 6 week mark, because you can get pregnant pretty early on. And the thing to know is that in more cases than not, you actually ovulate before your first period. So you're fertile before you know it. So when I got pregnant 4 months postpartum, I was exclusively breastfeeding. I did not have a period. And honestly, we were using condoms, right? So our miracle baby is now 5 years old. It can happen. So what we want you to know is what options are out there. And let's talk about how you can decide what's right for you. So the most important thing to know is how good or bad would it be if you got pregnant right away? You know, if you had a totally uncomplicated delivery and you're really wanting to have your kids close together, although we recommend waiting at least 18 months, if that's something that for your family you think is right, then condoms are fine, right? They can prevent pregnancy. They're not 100% effective, but it's an option. You know, do you have any contraindications? What that means, reasons for not taking a certain type of birth control. So if you've got migraines with aura, or you have really significant mood disturbances that have been worsened by hormones in the past, we want to think about non-hormonal options. And then are there other problems you're trying to solve with your birth control? You know, do you have acne, heavy periods? That can be something we take into consideration as well. So what we would recommend is think about these questions and then have a really good chat with your care provider about what kind of contraception or birth control you think is right for you. We discuss many of the different options out there, like natural family planning methods, coitus interruptus, which is the withdrawal method, and fertility awareness. And we talk about this in our YouTube video, so we'll link that in the show notes below. We can also talk about birth control pills and different types of IUDs. And we go through all this in detail in an extension in our prenatal course. So we'll link that course in the show notes below as well if you're looking for a comprehensive prenatal course that you can watch on your own time in the comfort of your own home that is evidence-based and presented by two lovely mamas who also happen to be maternity.
So another question that often comes up is, when can I drive after delivery? And even though you might think the answer is difference between a vaginal delivery and a cesarean section, it's actually not. There's no kind of legal answer to this. ICBC, which is our provincial insurance company for driving, says whenever it's agreed upon between the physician and the patient that you are feeling safe to drive. So what I usually tell postpartum patients is that you are responsible for the safety of yourself, of your baby, and of the people around you. So one example I give is, if your car were to light into flames, would you be able to get yourself and your baby out safely before dying? And if the answer is yes, because I can move quickly enough, great, you're ready to drive. But we also have to take into account other kids on the road. So if my children are on the road, I don't want you driving to potentially injure them if you're not up to it. And there's many reasons to not be up to it. One, pain from a vaginal delivery and a tear, or from an incision at your cesarean section. The other one that we often don't talk about is postpartum sleep deprivation, which can be significant. And so if you're not sleeping well, you're not safe to drive. And so figuring out an alternative form of transportation is really important during those first few weeks as an option. So that's one thing that a lot of people don't think about, is how sleep deprivation affects their driving. But we all know that if you've been up all night, you are not safe to drive the next morning, and you don't have the reflexes and the mental capacity to really keep yourself and your baby safe.
In terms of pain, you know what I tell patients is, I say, when you can slam on the brakes and shoulder check without pain. So sometimes you can get in, so that's basically what Alicia is alluding to, but I say get in your car and practice. And if you have those reflexes, you can hop out of your car, grab your baby, you're good to drive.
When it lights into
flames. I love that example.
My kids and I were driving home from swimming the other day, and there was actually a car in flames on the road. So there you go. It does happen.
It happens.
Sometimes.
And our last question, can I drink alcohol while breastfeeding? This is a question a lot of new parents have, and our general answer is yes, in moderation. But there's a few things we need to be aware of. The first thing is that alcohol generally stays in our system for about 2 hours, and our breast milk levels are about the same as our blood levels. So if you immediately have a glass of wine and you feel a little tipsy, baby's going to feel tipsy too. So if you're going to drink alcohol, do so in moderation, and do not breastfeed if you're feeling the effects. So try to have your drink just after you've fed your baby, and that'll give you at least a couple of hours for your body to metabolize and process that alcohol. And don't forget, if you have had nothing to drink during your pregnancy, your tolerance is probably going to be a lot lower than it may have been in the past. So, you consider trying, smaller amounts, or diluting if you're having a glass of white wine, add some soda to some fruit wine and make it into a spritzer, or start with half the amount of alcohol or a lower percentage alcohol than you're previously drinking. You could just try starting to share a beer with your partner. The biggest message we want to get across to you is that you do not need to pump and discard your milk, or pump and dump, which is a phrase I don't love. I don't know.
I know, it's weird.
I know, it's weird. So you don't need to do that. Just wait to feed until the effects of alcohol have worn off. If your baby's still hungry and you've just recently had a drink, then, grab some milk for your stash or give baby a little bit of formula to tide them over until you're sober enough to feed. But typically, alcohol is safe to consume in moderation when breastfeeding.
So there you have it, our top 7 questions with some tips and tricks added in there for the postpartum period.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.